97.5 Now FM, Lansing's hit music station, September 9th. It is a day set aside to bring awareness to fetal alcohol spectrum disorder. And it's not just a random day selected. It's the 9th day of the 9th month. The 9 symbolizes the 9 months of pregnancy. Joining me from the Michigan Department of Community Health, Rashmi Travis, the Bureau Director of Family, Maternal, and Child Health. Let's get right down to brass tacks on fetal alcohol spectrum disorder. Is there an acceptable amount of alcohol when you're pregnant?
According to the U.S. Surgeon General, no amount of alcohol consumption can be considered safe during pregnancy. So alcohol can damage a fetus at any stage of pregnancy. And some of the symptoms that may occur is it increases risk of alcohol-related birth defects, including growth deficiencies, facial abnormalities, central nervous system impairment, and behavioral disorder and impaired intellectual development.
So this is Fetal Alcohol Spectrum Disorder Awareness Day. That's a mouthful. But we always hear about fetal alcohol syndrome. What is the difference?
According to the CDC, fetal alcohol spectrum disorder is a group of conditions that can occur in a person whose mother drank alcohol during pregnancy. They can be physical problems, some of those which I had mentioned, as well as problems with behavioral and learning. Fetal alcohol syndrome is one of the most severe of these disorders.
So again, no amount of alcohol is to be considered safe during pregnancy, because even if you don't end up with a child that has fetal alcohol syndrome, there's a whole spectrum of disorders. Correct.
And we have tips for women off of our state website that can assist them in achieving a healthy pregnancy. Michigan.gov. We have several pages off our infant mortality, which includes our infant mortality plan, which includes resources to assist in fetal alcohol spectrum disorder. There's our home visiting programs, which also address fetal alcohol spectrum disorders through our maternal infant health program. Then there's also the behavioral health recoveries page off of the state website that can also provide some information, in addition to links to national and international resources such as the CDC that has several pieces of information that's comprehensible, a whole host of information on there.
So you have on the website and through the agency resources not just for setting women up to have a healthy pregnancy, but also you have resources if somebody needs help to stop drinking. We
do, yes. And at any point in time during the pregnancy, a woman can access these resources and try to find ways to get the most help that's needed, because, again, it's 9 months throughout the pregnancy that we try to provide these educational materials and information so that they can have helpful tips throughout the entire pregnancy and have a healthy baby born.
Just a quick tip, if you were going to give a quick tip for women to have a healthy pregnancy, what would be the first tip that comes to mind?
That would come to my mind is to get to your physician as quickly as you can, your OBGYN or your family practice physician, because it's important that you seek care under the care of a physician who can provide you with as much resources and information as possible.
All right. So today, Fetal Alcohol Spectrum Disorder Awareness Day.
Right.
And, again, appropriate because today is September 9th, and the 9 represents the 9 months of pregnancy.
Right,
correct. So Governor Snyder officially declaring today Fetal Alcohol Spectrum Disorder Awareness Day.
Yes.
Rashmi Travis, Bureau Director of Family, Maternal, and Child Health, Michigan Department of Community Health, and michigan.gov/infant mortality for more.